If you've been watching your hair thin and wondering whether there's anything you can actually do about it without surgery, daily medications, or side effects, I want to tell you about something we offer right here at University Pain Consultants Regenerative Medicine. I'm Dr. Rainier Guiang, a board-certified anesthesiologist and pain specialist. And in our regenerative medicine practice, one of the treatments I'm most excited about is PRP and PRF for hair restoration. PRP stands for platelet-rich plasma. PRF stands for platelet-rich fibrin. Both are prepared from your own blood, drawn right here in the office, and concentrated into a powerful solution of growth factors that we inject directly into your scalp. There's no donor blood, no surgery, nothing artificial. Just your body's own healing biology, delivered precisely where your hair follicles need it most. Hair loss, whether from genetics, hormonal changes, stress, or aging, happens when follicles miniaturize and stop producing hair. But in most cases, those follicles are still there. They're dormant. They've simply lost the signals they need to grow. PRP and PRF deliver a concentrated payload of growth factors, including PDGF, VEGF, and IGF-1, that reactivate those dormant follicles, improve blood supply to the scalp, extend the active growth phase of each hair, and help counter the hormonal signaling that causes follicle shrinkage in the first place. PRF, the second generation option, adds a fibrin matrix that releases growth factors slowly over 7 to 14 days, providing more sustained stimulation. This isn't experimental. A 2023 meta-analysis of 9 randomized controlled trials confirmed PRP significantly increases hair density at 3 and 6 months compared to placebo. A separate meta-analysis found a mean increase of over 14 hairs per centimeter squared. And when PRP is combined with minoxidil, multiple studies confirm it adds benefit. We draw a small amount of blood, similar to a routine lab draw, process it in a centrifuge, and inject it in a precise pattern across the thinning areas of your scalp. Every injection is physician performed by me personally under sterile technique. The whole appointment takes about 60 to 90 minutes. Most patients go right back to their day. You may experience mild scalp tenderness for a day or two, and some patients notice a temporary shedding phase before new growth begins. That's completely normal and expected. PRP and PRF work best for patients with early to moderate hair loss, where follicles are thinning but still present. It's effective for both men and women. It's effective for androgenic alopecia, female pattern hair loss, telogen effluvium, and even as an enhancement after hair transplant procedures. Visit us at our website or book a consultation directly. I'd love to talk through whether this is right for you. Your hair follicles may be dormant. They may not be gone, and your own biology may be exactly what it takes to bring them back. Disclaimer: PRP and PRF hair restoration are autologous biologic procedures. Individual results vary and are not guaranteed. This video is for informational purposes only and does not constitute medical advice. Treatment suitability is determined on an individual basis following a comprehensive physician evaluation. These services are not covered by health insurance. As with any injection procedure, risks include temporary soreness, bruising, and rare infection. PRP and PRF are not effective in areas of complete follicle loss or scarring alopecia. If you are pregnant, have an active infection, a platelet disorder, or are undergoing cancer treatment, you may not be a candidate. Please consult a qualified physician before pursuing any medical treatment.